Hello everyone, I am Berk. Some beliefs are more commonly seen in individuals with erectile dysfunction. Of course, these are sexual beliefs. In 2015, the study conducted by Serap Ader and her colleagues came up while I was writing this book, the Erectile Dysfunction book, as I was reviewing the literature or scientific studies. It came up in front of me. I missed that. It's really a great study. And it's not a study that has many examples around the world. I congratulate them for that. Here, some beliefs can be cultural, social, religious, or whatever. They can also be familial. Some beliefs, we know that erectile dysfunction, or more specifically those who have erectile dysfunction, is seen more frequently. Now, the most important thing is good sex, which ultimately means continuous sexual excitement and orgasm. All physical intimacy should lead to sexual intercourse. These two are almost the same. I made a video, kiss, lift, and insert hypnosis. That's what it's called. Actually, we talked about this very clearly here. If you haven't watched the video, I would recommend you to do so. The goal is for every intimacy, every sexual act to successfully result in orgasm in some way. It will bring stress to both men and women. It will especially bring more stress to men. That's why especially married couples, I said that cheese is not just about entering the vagina, kissing, cuddling, oral sex, masturbation from time to time. I mentioned that you should also engage in kissing and cuddling before parting. A man who fails in his first sexual encounter is not a real man. We encounter this very often. It's already the first sexual encounter, especially when the right time, the right environment, and the right partner are not present, we can face some issues as men, and the situation here can become permanent. So, okay, the time, place, and environment are not suitable, but will the erection problem that occurred there happen again afterwards? That's why they are always in a state of worry and anxiety, people in this belief. The belief about the difficulties in the first sexual encounter is important. Yes, now it's difficult to insert into the vagina. This is a serious matter. Sometimes I see couples, they haven't had any sexual relations for 2 to 3 years. Actually, they don't have a problem. There is no problem with the woman and there is no problem with the man. But they state that it's difficult and that they can't do it. We experience these things concretely. We're trying to explain on models, etc. But the belief that it is like this, it can really lead to problems with erections. Yes, strong men can have sex multiple times in a row. Some of these guys, even if they improve their sexual knowledge and skills as much as they can, are still unable to have sex. They are incapable of having sex. This is also related to trust issues. Especially there's this concern about whether I can satisfy the other person. There is a desire. So I had made a video about this as well. Actually, there is a video for everything, of course, but I don't want to repeat myself. About the topics. I always say that you can't satisfy women sexually. You don't have something like that. If you only do the things that she enjoys in any way, she can be satisfied, if she wants to. We had a slogan, everyone should enjoy and give enjoyment. Everyone is responsible for their own satisfaction. Here it's about being strong or being knowledgeable about sex or being ignorant about sex. Even if I'm strong, if I'm sexually ignorant, I won't be able to do this. She has anxiety and worry. This is, of course, an important issue. You know, if this is a really big problem that prevents you from having a relationship, I recommend seeing a sex therapist. Sexual intercourse is prohibited during pregnancy. This is important. Because pregnancy, well, here's the thing. The feelings of motherhood and femininity are different. So when people are pregnant, when women become pregnant, if the gynecologist says there are no issues, then intercourse can continue until birth. We don't have a problem with that. But if a man starts to see a woman as a mother, which he shouldn't do, because she is the mother of his child, not his own mother, if he starts to see her as a mother, then some problems arise. Because a person has a sexual relationship with his mother, a relationship doesn't make sense in a sexual context. And there are some conversations happening I'm really hung up on that too. Here are our mom and dad. So our mom went over there. Our dad went over there. I mean, she's not your mother, that's your partner. In this sense, women can also experience certain things. Some things can happen. What's happening? For example, there are women who struggle to feel like a woman again after giving birth. There are those who continue their lives with maternal instinct. Of course, maternal instinct and maternal feelings are not emotions that align with sexuality. This is the women's side of the issue. This is forbidden, so we shouldn't make it forbidden. It's prohibited. We shouldn't do it. We shouldn't make it forbidden, but at the same time, it's a problem that needs to be solved. For this, you need to consult a sexual therapist. In men, sexuality reaches its peak during adolescence. Belief. That's not true either. Yes, during adolescence, people can be very eager. Testosterone levels are high, chirpy, etc. But I read a study related to this. Let me explain that, for example, a newlywed at 20 years old, newly married between the ages of 20 and 30, but the happiness levels of people who have sex every day are similar to those of 80-year-olds. Couples who have sex once a year had equal happiness levels. So, actually, how much you want sex isn't that important here. How is your sex life? The experience you have matters. So, you may want it a lot, but if you're not experiencing sex, it doesn't mean anything. In this context, this doesn't actually reach its peak during adolescence. Desire can be attainable, that's a different matter. But sex, especially in the research is conducted, we know that it reaches its peak with an increase in quality between the ages of 30 and 50. In short, some beliefs, or rather, these types of beliefs are more prevalent among men with erectile dysfunction compared to other beliefs. If you have such beliefs, please let's change them as soon as possible. Sexual myths, wrong sexual beliefs really. It plays a very important role in sexual dysfunction related to sexuality, especially in our country. Thank you.